Hey guys, so in this video I thought that I would share my advice or share my own personal experience for how I handle patient callbacks while working as a medical assistant in the clinic that I work at. For those of you who don't know, I am currently working as a sleep tech, but I am still a medical assistant and I still work as a call-in medical assistant for the clinic. So I still have access to all of that stuff, and I currently work part-time sleep, part-time clinic, and that will be changing in the next couple of weeks to full-time sleep and only call-in clinic. But for now, I just thought that I would share some advice because I did have a person who asked me, like, how do I figure out how to prioritize the patient callbacks? And for those of you who are completely unaware, if this is something totally new to you, when you're working as a medical assistant, at least at the job that I work at, we are responsible for making certain telephone calls to our patients. And that is just what I mean by like patient callbacks. So there are a number of reasons why you might need to call the patient, whether it has to do with a medication refill, trying to get them to schedule an appointment, or something as simple as giving them results. And I'm sorry if I keep having to clear my voice. Like, I feel like I need to cough, but I'm not. Like, I don't know how to explain it. But anyways, hopefully that's the last time. So with patient callbacks, we use Epic, so I'm able to see if something has a red arrow on it. If a provider or someone else in the clinic has marked something as like with a red arrow, that means that it needs to have a higher priority, which means that it should probably be handled first before something that doesn't have a red arrow. So things that would automatically have that red arrow next to it would be like abnormal test results, or something, like I said, that has been marked urgent. And like I said, that would be something that needs to be taken care of before you go and like try to schedule Miss Betty for an appointment. So I will go through the list of patient calls that need to be made. For those of you who don't use Epic, I don't really know how to explain this to you as easily, because like within Epic, we have it set up where you can see like patient calls. It's separated by like patient calls, result notes, results, prescription responses, and prescription refill requests and things like that. So it's all separated like that in Epic. And like I said, I've only worked as a medical assistant within the Epic system. Prior to me being hired at the clinic that I work at, they used ECW, which is 𝐸ClinicalWorks, but I did not ever have access to ECW, so I've only ever used Epic while working as a medical assistant. So I'm sorry if some of this is a little bit different, but hopefully you can still get helpful information out of this video. So what I will do is I will go to, I usually do results first, if I'm being honest, and I will look for any of those red arrows, like I said, which signifies the abnormal results, and I will try to call those people first. After I've gone through that list, I will switch out of the results and the result notes. Some of our providers use result notes, some of them use the results tab. So when I say results and result notes, I kind of do the same thing. So I'll go through one, check all the red arrows, go through the next, try to call all the red arrows. After that, I will go to patient calls, and I will do the same with the red arrows. And normally, if there's no red arrows, which is very, very rare, but it does happen, if there's no red arrows, I will go to the results or the patient calls that are the oldest, because I try to get the oldest ones handled and out of the work queue as quickly as I can, because those are the ones that have been sitting there the longest that really should be acted on before any of the newer ones. So whether that is the patient needs to schedule an appointment, like I said, or we've been trying to call them and just can't get through to them, you know, for whatever reason, we will continue to call. Now, what I will do is if the person needs a phone call, whether it's about results or whatever, if they have been called at least twice and no one has gotten through to them, I will try to call one more time. And I have a rule where it's like 3 strikes and you're out, but they're not out. So what I will do is if the person has been called 3 times or more and still has not been gotten a hold of, or there's been messages left and they still haven't gotten a hold of them, I will send them a letter, which through Epic is very nice because you can just click buttons and it will create and generate a whole letter for you based on different templates that are available in the software. But I will literally send them a message or a letter. I will mail them a letter, or if they have MyChart, I will send them a MyChart message to try to get in contact with them. And sometimes it's as simple as saying, "Dear such and such, we have been trying to get a hold of you for a while now about such and such," and I will put in whatever reason I'm calling, whether it's, I've been trying to get in touch with you regarding a medication refill that we had questions on, or whatever the case may be. Because like I said, it's gonna depend on the actual situation. I will write that in there, whatever the case is that we've been trying to contact them about. And I will say, please contact the office at your earliest convenience at 111-111-1234, whatever the phone number is. And then, I will just say, thank you for your prompt attention to this matter, or something like that. I use whatever the template says, honestly, and I just kind of cut things out and add things in where I need to fit the actual situation for that patient. So I will go through all of that. And sometimes there are patients who just don't respond to either a letter or a message. Some of the MyChart messages, I do make sure I send myself a reminder to check and make sure that they have been attended to, like they've actually been seen by the patient, because if not, I will continue to try to either call them or send them a letter. And I mean, if we've sent them a letter and they're still not responding, I will sign that encounter saying that a letter has been sent and there has been no response, just to get that out of our queue. So it doesn't look like we're just holding on to things and not contacting the patient, because obviously there is some sort of tracking that needs to be in place, because patients do need to know the information that we're trying to give them. But if we are reaching out to them repeatedly and they're just not reciprocating that communication, there's really nothing that we can do sometimes. Although I do also tend to look, like if there's a patient that I know we've been trying to get a hold of for a while and they have an appointment, I will try to remind the provider to go over that information with them during the visit if possible, to talk about the results or to ask those questions about the medication refills. Usually when it's about the medication refills though, people are pretty good about getting back to us because they want their medications, and our providers will not send in those medications until those questions are answered. So, which is a good thing, because if you have a question about a refill, those questions should be answered before you just blindly send in a refill. But I mean, I don't know if every practice works that way, but they should. So anyways, like I said, that is how I prioritize. I go through, on Epic, it's really easy to kind of prioritize those. First, I go through and check off all the red arrows that mark those as urgent. So then I can very easily see which ones are urgent. And then I will just kind of work my way through the rest of them based on the oldest ones to the newest ones. So that's what I try to do. And like I said, after a certain number of phone calls, they're getting a letter or a MyChart message. And honestly, sometimes with results, if it's a patient who I know we've had trouble getting a hold of in the past, if it's a normal result, I will mail them a copy of those results and say, based on such and such, your lab results are showing normal results. And this is something that the provider has put in the result notes, I should say. This is not just something that I'm telling them. I'm not calling anybody with results unless the provider has literally written on there what they want this person to be told. So if it's a normal result, I will send them that in a letter, send them a copy of the lab results so that they can see that for themselves if they're just not someone that we can easily get a hold of. And I've also gotten into the habit of people with MyChart. If it says that they haven't seen those results yet, I will send them a message through MyChart. Sometimes even if it says that they have seen it, I will send them a message through MyChart just to say, hey, I just wanted to make sure that you didn't have any questions about what Dr. Smith said about your lab results or whatever. And that way they can message me back if they did have questions and I can forward them on to the provider. Or they can say, no, thank you, I saw that, blah, 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 whatever they say. So anyways, I hope this was helpful. Let me know if you guys have any other questions about working as a medical assistant or anything of that nature. You know, I would be glad to share my knowledge with you. And with that being said, that's all I have for today. Again, I hope this was helpful. I'm sorry to the people that don't have Epic because they may not understand. I don't know about the other charting softwares because Epic is all I've used as a medical assistant. So I'm sorry. But anyways, let me know if there's any other topics you'd like me to discuss on my channel in the future, and I will talk to you guys next time.